So this is Dr. Antolak from thegentlendentist.com in Shelby Township, Michigan. Our phone number is 586-247-3500. And one thing I like to do educating wise is how to brush teeth. And one thing that that we want to do, and the reason why I emphasize toothbrushing, and you'll see from this picture that's right over me about something that's taken place with a patient I've recently seen who was too aggressive with their toothbrush. When we brush teeth, we want to make sure that we angle the toothbrush up to the teeth and do small circles, okay? And we want to start off in one direction and continue around right towards the gum line, and then come around like this here, then do the bottom ones like this, and then do the inside the same way. And what happens is if you use too hard of a brush and you're too aggressive and try to scrub like this and scrub the other way, you can actually wear away the tooth structure, the gum tissue, and the bone. And let me show you in this case. So this patient came in, this is the left side of his mouth, and we can see normally the enamel of the teeth are about this level here at the bottom of this toothbrush here. And so what he did is, over a period of time, by brushing too hard, he's actually brushed the entire root of the tooth away and the bone that was covering over this area and the gum tissue. Normally, like I say, when he smiled at one point in time before he did this damage, it would have been like this, okay? But now, it's way up to here. This exposes potentially the nerve, actually can get exposed from that, and you wear away the supporting structures of the teeth. So there's less there to handle that. So it's real important, even sometimes with people like this who may clench their teeth. That has a factor. Clenching does. If they use an abrasive toothpaste, even that will really increase the level and the speed that the gums and the teeth and everything wear away. It can become too abrasive, and so we can see this is unhealthy. See, he didn't. In this case, he wasn't able to reach all the way back here to this tooth, so this tooth is fine. So this one right here is how it naturally should be, but these teeth are obviously really too bad. If we look at another photo here of him, you can see that one is of the same side, but you can see the level of destruction that's taken place. And so, let's see, this one right here shows his other side of his mouth where he does have the same similar thing, but you'll notice here on the top, this one's fine, and his lower teeth are fine. See, the lower teeth, this is how they should be, not sticking way up like that. So, believe it or not, over a period of years, and if you're too aggressive with brushing your teeth, you can literally brush them away. What I recommend for our patients who have hard toothbrushes like that, I tell them to use it for the grout in their showers to get all the mold and bacteria off, because that's about what they're good for. Please just use a soft or an extra soft toothbrush if you use a manual brush. If you don't, use a Sonicare. It's going to be your best thing that you do for yourself. Thank you, and if there's any questions, you can give our office a call at 586-247-3500. Thank you. This is Dr. Antolak from thegentlendentist.com in Shelby Township, Michigan. And as a follow-up to a previous video I did, I just realized that it's a good idea to make note that what happens with teeth that have so much wear on them. As we age, actually our nerves, our pulps that are in the teeth actually shrink down and get smaller and smaller. Sometimes trauma, for example in this patient's case where they lost a lot of the tooth structure itself, where it's literally dished out, grooved out, maybe 1/3 of his tooth is missing. But what happens is over time, if it takes place over time, the nerve responds, and this is how God made us, is so that the nerves will actually shrink down and get smaller and smaller and smaller. If a situation like that took place on a very rapid basis, this would have all been right into the nerves of his teeth. But the fact, and you can even see some of the different colors, see how it looks dark right there? That's actually where the nerve must have been. But then the body has been able to respond to this trauma and shrink the nerve down. And this is how our bodies are made in amazing ways to compensate for traumatic events. So if you're interested in knowing more about this, or the fact that if you need to have something done to prevent destruction that takes place in your mouth, please give us a call at 586-247-3500.